Good morning, Karen. Okay. The I want you to tell folks about this therapy, acupuncture and myofascial release. And let's start from the beginning. Why did you come here and who referred you here?
Okay, first of all, my daughter referred me because she worked for you, and also because after she gave birth, her neck she had gotten a really bad stiff neck from the birth, and she said, I have to go to Dr. Rodriguez so that he can fix my neck, which he did in she said it just took 2 visits and her neck was fine after that. My problem is my back, my lower back. I was getting steroid shots every 6 months and it was getting to the point where I seemed like I would have needed them more. But the problem with steroids is that you can only take them for 2 years, which means after 2 years, what do I do? And I'm past the year point. What am I gonna do now? Not to mention that the steroids messed with my diabetes, which wasn't a good thing. Yeah. And my daughter said to me, well, why don't you go and see what he can do for your back? She says, what's the worst that can happen? It won't work. She says, if it works, she says, you don't have to go for the shots anymore. So I said, well, that sounds good to me. I'll try it, even though I didn't know really that it would work or that anything would change. So if you're looking at a lifetime of back pain and trying acupuncture, I guess you don't have much of a choice. Yeah. So I went, and sure enough, within a couple of sessions, even after the first session, I noticed a difference, but within a couple of sessions, I don't have any pain anymore, and it's amazing. It really is amazing. Okay.
So did any of your doctors suggest acupuncture or this type of therapy for your problems?
No, but when I suggested to my my internist that I would like to try it, he said he doesn't see anything wrong with it. He said it could work. He says if it works for you, he says that'll be good.
Okay.
So he wasn't against it, saying no, don't do that. Okay. He said try it. If it works, that's good.
Okay. Now, then all this evolved into what? Your respiratory problems, your sinus problems?
Yeah, well, I was having respiratory problems when I came to see you, when I was already seeing you for my back. So you said that I can fix that. I'm thinking to myself, well, it's allergies, a lot of it, and but if the other worked, why not? I was willing to try, and it has worked. I didn't realize it worked until the allergist told me that she found that it cleared my coughing cleared up much faster than she thought it would, and she said she doesn't understand why. And then I explained to her that you were treating me already for the coughing and the sinuses, so I had to decide. I said, well, that's what it's from,
Now, is it uncomfortable? Is it painful?
No. It's not even really uncomfortable. Sometimes when you put some of the pins in, they hurt in certain places. They don't hurt everywhere. And then the pain stops 2 seconds after it's in, so it's not a big deal.
So would you recommend this to other folks?
Oh yeah, absolutely. What have you got to lose? First of all, there's no medication to take. And you're not groggy. It doesn't like one of my antihistamines now makes me very dizzy, and I had to stop taking it. So
good.
You can't walk around dizzy.
Thank you very much.